So we're back again with another round of treatment for my beautiful patient here, very young. Uh, You're so funny. But yeah, so a lot of our patients wanted to start with their injectables because that's what I call immediate gratification. But I've been seeing my patient since last year already, or more than a year ago when we started treatment. So the last one we did was a series of laser treatments, and we've seen significant improvement already. My patient likes the natural way. That's why, believe it or not, I have not injected her face. So we're just doing lasers, skin tightening, and this time around is radiofrequency microneedling. And how was your experience so far with me?
It was wonderful.
Oh,
You are so good
Oh, yeah.
at what you do.
So what we're doing today is what we call Trifecta Radiofrequency Microneedling. So what it's doing is threefold. The radiofrequency, we know that already, is a cutting-edge technology when it comes to collagen renewal. And you've seen this before, but they've got 36 microneedles. Maybe we can show you to that. It's tinier than the Botox needle. So what it's doing is puncturing, creating micro injuries to the skin and delivering the radiofrequency or the energy down to the dermal layer. So we are creating collagen, making the skin look better, even without injectables. So here at Alii Nani, there's always an option that I provide for my patients. We can do the immediate gratification route, meaning to say the injectables. But I also want my patients to understand that signs of aging present itself in different ways, okay? And not everyone is a good candidate for injectables too. That's why full face assessment is important. And some patients too would rather just go with a natural way of doing it, meaning to say using devices or like doing non-injectables, just like the case in my patient here. So after this treatment, the cherry on top that I would say is we infuse growth factors, peptide factor, which accelerates the healing of the skin and also collagen renewal. So remember, we created microchannels there. So what would be your post-treatment care? There's a little downtime here, but no significant social downtime, if I may say. You can see that her face is starting to turn a little bit reddish, just like she had a walk out in the park or went to Colina. But the redness subsides. Case-to-case basis, sometimes it could be after a day or two, it could be after a few hours, but in general, it's really not that bad. Just like discomfort, of course there are needles, but as you can see, there's no blood. It's a bloodless microneedling because the heat coagulates the blood. So this treatment is good for all ages. How are you going so far? Good?
Terrific.
Terrific. Okay, that's good. And I know patients, so if that makes you feel a little bit more comfortable with the procedure. Beauty pain with a lot of beauty gain, okay? So how often do you do the procedure is really dependent on your expectations, the overall quality of your skin. So most of my patients, I start them with minimum 4 sessions spaced out 4 weeks apart. And so there's always a date time. My patients always look forward to that day that they're visiting because it's gonna be a daytime with me. Suddenly you're like, Okay, well, thank you for the bok choy. I'm gonna make it later when I come home. So we are now doing the micro infusion of the growth factors. And so post-treatment care, of course, sun protection today. Don't do your skincare. You can resume tomorrow when the redness subsides, okay? Some areas like forehead, under the eye, it may scab, but don't pick it. It will just fall off. And by the time you come back in your next appointment, you are going to love the result. And I know you still got one more treatment with laser, okay? So we will schedule that in 2 weeks. In another 2 weeks, I'll see you for the continuation of this. So you're all hooked up.
She likes to see results.
And I see your results. That's why I was like staring at your skin earlier, because I could really tell, because I've been seeing you for quite some time already.